growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, this is Dr. Steve Rasner, and you are tuned in to The Lionhearted. If you're tuning in for the first time, these are weekly podcasts where I try to hit hard that subject matter that I think will have the greatest impact on what I think is an excellent occupational choice by you. And I know from being a speaker for many years that many of you might disagree with that point of view, and that's why I'm here. I'm a dentist from a part of the United States, southern New Jersey, that went back to his hometown to practice years after, being away in college and dental school. And like many of you, economically, it didn't turn out to be the best of choices. I got to tell you something along those vibes. I just happened to look in the Atlantic City Press. That's a newspaper here on the East Coast. And they were listing the median incomes in New Jersey. So there's one place in New Jersey called Short Hills where the median income is $200,000. I understand I think that's pretty substantial. And the median income in the area that I practice in is $26,000. So I know lots of you listen because you think I live in your world, which I do. So what this podcast is about is a dentist that had average skills in dental school and trained really hard to become a pretty good clinician. I would like to think better than pretty good. And then for sure has put together a business model in dentistry where it is primarily, and I mean the overwhelming majority, a fee for service practice, and held on to staff members for an average of 20 years, 18 different staff members, kept a repeat patient base as clients for years and years. And look, that wasn't as hard to do back in 1980, but a lot of things changed in the last 39 years. And so if you're tuned into this is what you get from me. You get a wide array of topics. I tend to get off topic at times. I try to keep it as conversational as I can. You can reach me at my name, Dr. Rasner, DrRasner at AOL.com. And my courses where I speak are to be found at the Rasner, Rasner Institute.com. So listen, welcome to the fall. It is now fall of 2019. And you know what that means for me, and I hope it means for some of you, is I want to bring up just a brief topic for a minute of goal setting. Before I do, I want you to know the subject of this podcast, I'm trying to make them as more threaded than I had in the past. So I go back and I try to listen to things I was talking about on recent podcasts. And I know I've been talking about how to maximize your productivity through maximizing that new patient visit from the time that they called you. And they're pretty, in my opinion, they're pretty good podcasts, the last few, where you're really having me break down everything from how you brand, which means how do you market, and what impact that has on the patients that are coming in to see you. In fact, it has an impact on everything you do. If you advertise that you're, an urgent care type of practice, if that's the marketing message that you're sending out, then it should be no surprise to you that you spend your days with new patients who have faces swollen out like this, and or if you market you're the most affordable dentist, and if that's what you choose to do, and you're comfortable with that, then go for it. Look, all this that I impart to you comes from the fact that I know you got one life. And I don't mean to be overly melodramatic, but you do. And you chose a profession that I chose. So I can help you a little bit with that. And how you spend your years, and by the way, they can just blow right past you. I don't even want you to get stuck in the poor place of horizontal non-growth for the next 10 years, where you did okay, but you could have done a lot better. So when you hear me talk about the subjects I bring up, it's because I really think they have the greatest impact on you. So when I talk later in this podcast about the importance of getting paid up front, it's not because I'm greedy. It's because I find that the positive outcomes of you doing that put you in a very different place than those who don't have systems to get paid up front. So when I tell you about the advantages of getting paid up, it's because I know it has a multitude, a domino positive effect on everything you do, on how your practice runs, on your mind, on everything, on the patient. It actually clearly benefits the patient, and I'll explain that in a minute. Part of the reason I got to a place where colleagues want to know my opinion on things came from the place that I set goals throughout my career. And I know that sounds to many of you, it's kind of like a turnoff. Oh, here we go, we're going to talk about goal setting again. But I really did it. And all I can share with you, and I'm not like goal-setted guy out of my mind. I'm not that person. But I did have some basic goals. And whenever I turned a corner, which, I said for a few minutes ago, welcome to fall 2019. So we're certainly in the final turn. So here's the thing. I don't think you'll ever grow if you don't have goals. So when I say goals, my goals were always broken down to goals I could accomplish within 6 months and goals I could accomplish within a year. And I also would always break them down into business and personal. And look, to me, stagnation is your enemy. And if you do nothing different between now and January 1, 2020, or now and March 2020, I don't know how that can feel good. And when I say don't do anything different, I mean personally and business. So let me give you some examples of what I would do if I was you and what I'm personally doing right now, as a matter of fact. But goals help you bring change. They make you accountable if you don't do enough to reach this change that you're seeking. But goals have to be specific. For example, you can't say, I want to lose weight by the end of the year. It's not a goal. I want to lose 12 pounds between now and January 1st, 2020 is a goal. And then you have to decide what it is. You can't just say that. You have to have a game plan, a goal plan to get there. Maybe you haven't saved money in the last couple years. You know why? Besides, in your mind, because I don't have enough money. That's what you're telling me. I will tell you because you never made it a specific goal to do that. I know that if you said to yourself, I'm going to save $10,000 and divide that into 3 months between now and the end of the year, I'm positive you'll do it. You'll take it right off the beginning of each week. And quite honestly, the only reason you haven't done that is because in your mind you'll say, well, I don't have the money. That's why I can't do it. Goals, that's what goal setting is about. Or maybe a long-term goal, a year goal, is that you will sign up for a master track, assuming you have your fellowship in the AGD. Maybe you'll sign up for your master track to begin in 2020. I mean, this is how it gets done. You sign up for things. And to give you an example, I'm doing it right now. I mean, I am in my 39th year of dentistry. And I realized that most of my implant and surgical training, which is precise to me, that's my focus, is within the United States, that I've never been taught by some of the greats around the world, like Dan Boozer, who's an oral surgeon. I forget where he's from, but he's in Europe. And I am presently seeking out what courses, and you know what's interesting? When you do that, it leads you to other things. So I started out my challenge by looking up what Dr. Boozer, where he's teaching, and I found other names that I am familiar with that maybe that date is more convenient in my schedule for 2020. But the point I'm making to you is right now, I guarantee you, when I come back next year this time, I will have taken at least 2 continuums, 2 3-day or 4-day courses with 2 of those surgeons from Europe. And I did that over the years with Pecos Institute in Tampa, Florida, or the Spear Institute when it was up in Seattle, Washington, and the Coys Institute. That is how I became a pretty decent clinician. So, that's professional goals. And then, of course, there are personal goals as well, which, by the way, would include, which I also am doing, strategizing for a vacation or a trip. And when I say that, I mean I'm paying for it. I'm putting a deposit down on whether it's the course or the vacation, so it happens. So I don't want to overwhelm you with that, but I will tell you this. If you're not goal setting to some degree, short-term goals under 6 months, long-term goals for the next year, you're likely stagnating. I don't want that to happen to you. So let's talk about money. Yep, I said it. Money. You've heard me on other podcasts talk about why I feel that getting paid up front has so many benefits, and yet it's such a small philosophy embraced by minimal dental offices. And I get it. It's hard to do because in your mind, the concept is, why would a patient pay for something, or how could I even ask them to pay for something that I really haven't finished yet? And I get that. And I'm going to explain why to you. I'm trying to get you focused right now on what I think is important going forward with helping your practice get organized. Because the positive domino effect of you getting paid up front and embracing that philosophy is just huge. So, number one, it clearly is best for the patient. And you've heard me say on other podcasts, the reason I say that to you is I have done all the opposites that you hear me advocate on these podcasts. So I had 15 years where a patient would come in and we would break down their treatment into the number of visits we thought it would take, and their out-of-pocket expense, we would divide that up. And invariably, if you do anything like that, what happens is something in your patient's life preempts your visits. So you get a lot of broken appointments, particularly if the next appointment required a payment of more than $2,000. And the worst part about this is that the ultimate outcome is that the patient often leaves you with unfinished work. A prepped tooth with a temporary crown on it. A root canal started but not finished. Scaling and root planing started but not finished. Because it's easy to quit if you don't have your full commitment in. I get it. And you never come out of that picture a winner. It's very, very few people, it's my opinion, that are honest enough that'll say, you know what, it wasn't the doctor's fault, it was my fault. I quit going, but I quit going because of blah, blah, blah. It's always tied to a negative. So here's the thing. Either your patients can afford the care you recommend or a substitute of what you recommended, or they can't. To design a convoluted payment plan that is stretched over a period of a year, or in my opinion, even 6 months, so that it sounds more palatable to that patient, is just a recipe for disaster. I don't think you should do that. So how do you get paid up front? Well, either write to me, and I'll give it to you, or remember Michele with one L, Michele, at pearlsmiles.com. Michelle's been my new patient and financial coordinator for 39 years, and she gets it. She's lectured on the circuit with me before. She's a very unassuming, very, very smart person, very people-oriented, and she knows the importance of how you say things, and does believe in the principles of why, what I just shared with you, of why it's best for the patient to pay up front. And when I say that, by the way, I'm talking upfront. So what happens is I will present to the patient what I would do if they could do it. And then I will say to them, at this time, what's going to happen is Michelle's going to come into here. And you know who Michele is, and they all know who Michele is. She did the initial phone call. She did a in-office 5-minute one-to-one interview with them and their significant other about what today was going to be about. So they clearly know who Michele is. And she comes in and I want Michelle's approach to be laid back. Yeah, we're trying to get paid up front. But she's not walking in there like the salesman in a car dealership, who's got all these tricks up their sleeve. At least from my opinion, they do. They got one agenda, and that's to get money in their pocket. Yes, we want to get paid up front. We also want it to be comfortable for them, or we don't want them to do it. And I don't know if I thought like that 30 years ago, but I certainly do now. So what I will say to that patient is, you know what? Her job is to figure out in dollars and cents what I've just recommended to you and see if it fits in your world. That's what her job is. Now, I got to say this to you. The success of her doing that has a lot to do with what I just did with that patient. If you walk in and you are even a little bit apathetic to the process, even after 39 years, I'm pretty certain that my patients are sensing that I'm really into this and I'm really into their case, whatever that is. Maybe it's a terminal dentition case where the patient is about to make a big decision in their life. Are they going to keep a few teeth? Are they going to go all out regular conventional denture, an implant retain, prostheses? These are big decisions. And I am engaged, and I know many of the people that listen to me are equally engaged, and you are tuned in to what that patient needs. Maybe it's forefront veneers, maybe it's basic operative dentistry, and nothing more than that. Whatever it is, they're not ever going to say I'm apathetic. If you have a apathetic case presentation, then what I'm about to tell you isn't going to work. Now I'm not in there rah-rah cheering on. I'm just breaking it down, being methodical, tuning in to what I think is relevant to this particular patient. Maybe they're greatly fearful. Whatever it is, when Michele comes into the room, she has an engaged patient. Okay, so she's not going to not get the case because they don't believe in me. I can tell you that. And that can't happen to you either. And by the way, if this is not a strong part of your presentation to a patient, then you can work on it. You can have somebody video you. I absolutely believe, everybody in the world can improve their singing voice. Do you know that? They can. Everybody can improve their acting ability, even if they didn't have any aspirations. So you certainly can improve upon what I am talking about, which is your communication ability. Don't forget who you are. You are a hired gun, so to speak, by this patient that found their way from your community into your dental chair on a given date. And they are there for your recommendations. Now, what are they seeing? What are they feeling? And it all leads to this moment that has such an incredible impact on what you do each week, on what you do each day. That's why my business used to be called Realizing the Dream. I changed it last year to the Rasner Institute. I reluctantly changed it because that'll come up better in Google searches, I guess. But I got to tell you, the reason my business was called Realizing the Dream is because it was a dream to me that you could have all the setbacks that I've had in my life, from graduating at the bottom of my class to a lot of other things that have happened in my lifetime, to going into work 4 days a week, getting to do challenging procedures, getting paid for those procedures, being appreciated by patients in a climate and in a region of the United States that's not easy to do. That's why it was called that. And I'm trying to set you up for that right now. So I say to them, Michelle's going to come in and she's going to see if she can fit this in your world. And I think the biggest change in me in the last 10 years is that if she can't, then I don't want him to do it. And there'll be another case down the road, tomorrow, whenever it is, I don't care. Your job is to keep your soul in place and to really be honest with what they need and don't need. And can you segment these treatments? Or do you have to, obviously, if it's a terminal dentition, and often you have to do that, all at once. So then she'll come in, and what she often will do is she will sit with them. Now, you can get the language specifically from her if you care to. I gave you her email, or email me. And she will try to make this is something they can fit in monthly to their budget over a period of whatever works for that patient. It could be 1 year, it could be 4 years, even 5 years. But here's really an important thing. If the takeaway is that, yeah, they can kind of afford the monthly $400 payment, but they come to resent you because they feel talked into something. That isn't your job. Your job is to try to set up a financial avenue for them to have this work that you just discussed. I know I'm beating this to death, but it's a big issue. Because I don't get a lot of buyer's remorse anymore. There were times in my career where I got more of it. I'm serious. Maybe we weren't as sensitive. Maybe we didn't say things as specifically as we do now, which would be, are you okay with this? Does this work for you? And you just never know. I want to tell you about 2 patients I had in the door this week that went through all the channels that Steve Rasner puts them through and were complete opposite outcomes. I want to tell you about them real quick so you understand I live in your world and I do face the things that you face. One was a woman who was recommended to me by another patient, a patient of mine of 30 years. And her big deal was fear. And I usually salivate over that patient because I'm so successful with that type of patient. Well, she came in, I gave her my full attention, knew what her concerns were, and I always emphasize the positive with these patients as I can. So this is a patient that admittedly has never had significant comprehensive care. She had most of her work done without Novocaine. How's that for you? She needed quadrant scaling and root planing. She had broken off molar on the lower left side that needed a crown. It had one cusp left. I'm not trying to oversell this. This is what this was. And just a couple fillings. I spent 30 minutes, maybe more, talking about the advantages and the appropriateness of a comprehensive care approach, because her main concern was a little lost incisal edge on number 24. And she wanted, after all that, you know what she said? She said, my old dentist, who retired, would have had that filled already and the cleaning started, quote unquote, the cleaning started. Obviously, we didn't treat her. And, I had said to her at one point, I said, every dentist has to draw the line in the sand as to what he's okay overlooking. And I'm not okay. I realize I'm not trying to be the bad guy here. You just want this little filling done in the front. But it's not that she wanted to come back and have scaling and root planing. And trust me, it was radiographically evident. It was everywhere. And of course, the crown was the crown. Even if you tried to fill it, it needed something. She knew about that as well. She wouldn't do it. She wouldn't do sedation. She didn't want to be numb because she felt out of control. And then I had another patient that ended my week that had multiple teeth missing. He only had 5 teeth in his maxilla that could be salvaged. They were old crowns that had a little bit decay. He didn't really have perio. And if you looked at this guy versus the patient I just discussed, you would have never dreamed that he would be interested and would pay for a treatment plan north of $18,000. So you can't look at patients and tell if they're the right patient to present this to. You go back to my case presentation and buying trust at the same time. It absolutely works. But sometimes, it's always the patient's decision. And quite honestly, you're much better off not getting some of these cases. I think I'm way better off than if that first patient maybe had agreed to try this. So anyway, I hope this helped some of you this week. I'd like to continue with the subject of the benefits of getting paid up front, the least of which would be the fact that it improves your cash flow. And when you have improved cash flow, the most important outcome of that is that it gets rid of the pressure for you to think that you have to get every case. You know, sometimes we have those weeks where, God, we really be nice if somebody came in that needed a lot of dentistry. But when you have good cash flow and you owe the patient, they don't owe you, it's a much better dynamic for you going forward. It really takes the pressure off the whole operation. So if you want more information from that or specifics, please write to me at the email I gave you. Otherwise, go out there and have a great week this week.